In this video, we'll explore what deafness is, the different types of hearing loss, and how it affects a student's development, learning, and daily school life. We'll also look at assessments, medical treatments, and most importantly, how educators and educational assistants can support deaf and hard of hearing students in the classroom. So, what is deafness? Deafness, or hearing loss, refers to a reduced or absent ability to hear sounds. In education, deafness is often understood in terms of how much a student relies on visual communication, like sign language, lip reading, reading, and writing. Some students can hear and speak with the help of hearing aids or cochlear implants, while others primarily use sign language. All of the students can learn, however, students that have deafness access information in different ways than other students. Now let's discuss different types of hearing loss. The different types of hearing loss are sensorineural hearing loss, conductive hearing loss, mixed hearing loss, and auditory neuropathy spectrum disorder. Sensorineural hearing loss happens when there's damage to the inner ear or the hearing nerve. This type is usually permanent. Conductive hearing loss is caused by a blockage or a problem in the outer or middle ear, which stops sound from getting through properly. Some students have mixed hearing loss, which means it includes both sensorineural and conductive components. There is also auditory neuropathy spectrum disorder, where the sound enters the ear, but the signals don't travel clearly along the hearing nerve, making speech hard to understand. Next, we have bilateral versus unilateral, and congenital versus acquired. Bilateral hearing loss can be in both ears, and unilateral is just in one ear. Congenital hearing loss can be either present at birth or acquired later due to illness, injury, or other factors. Next, we'll talk about the characteristics and everyday signs. Deaf and hard of hearing students may show a range of characteristics in the classroom. They might miss parts of spoken language, especially in noisy spaces or when people talk quickly or mumble. This can look like not listening or ignoring others, when in reality, they simply didn't catch what was said. Without early access to full language spoken or sign language, some students may have delays in language, reading, and writing. They can struggle with slang, jokes, or fast groups within their peers, which are mostly auditory. Over time, constantly trying to fill in the gaps can lead to frustration, stress, and sometimes withdrawal from social situations. Deafness affects more than just the hearing. It can shape development across several areas. Let's talk about the developmental consequences. Early access to language is critical. When children have rich exposure to sign language or spoken language from an early age, it supports later reading and writing skills. If they don't have that access, they may experience delays in vocabulary, grammar, or literacy. Children that are deaf are not born with lower cognitive ability. However, if they miss conversations and explanations in their environment, it can limit opportunities to build concepts and problem-solving skills. At school, students who are deaf or hard of hearing may feel isolated or left out, especially during fast-paced discussions or group work. Misunderstandings can lead to them being labeled as rude, distant, or not trying, which can hurt their self-esteem and sense of belonging. Hearing loss is identified through specialized assessments, often starting very early in life. Many babies take part in newborn hearing screening, where soft sounds are played into the ears and a computer measures the response. Tests like auditory brainstem response or ABR measures how the hearing nerve responds to the sound. This test is done while the baby is sleeping. As children grow, audiologists might use visual reinforcement audiometry, where the child turns towards the sound and is rewarded with a toy or light, or conditioned to play audiometry, where the child does a simple action when they hear a tone. Older children usually complete pure tone audiometry, pressing a button when they hear beeps through headphones. These assessments help determine the type and degree of hearing loss and guide decisions about support and intervention. Medical and technological supports can give students a better access to sound. Let's talk about different types of medical treatment that is available. Hearing aids amplify sound to make speech and environmental noise easier to hear. And cochlear implants are surgically implanted devices that bypass damaged parts of the inner ear and send sound signals directly to the auditory nerve. In the classroom, FM or DM systems can send the teacher's voice directly to the student's hearing aids or implant, reducing the impact of distance and background noise. These technologies are most effective when hearing loss is identified early and when they are used consistently alongside educational supports tailored to the students' needs. Educational interventions are crucial to help deaf and hard of hearing students fully participate in school life. This is where the educational system plays a key role. First, we focus on access to information. This includes ensuring the students' hearing aids or cochlear implants and FM systems are working and used consistently. Supporting strategic seating so the student can see the teacher's face clearly and follow lip movements. Also encouraging teachers to face the class when speaking and to avoid talking with their back turned. And lastly, helping with captions, transcripts, and connecting audio from videos or devices to their tech.